Good afternoon, everyone, and welcome to today's webinar. It's Managing Your Pelvic Floor, and so our presenter today is Bec Walhout with Jody. All right, so before we get started, we just want to sort of discuss, with Women's Health Week, that we want to make it clear that when we say women in the discussion, we mean people who were assigned female at birth. And so it's important to know that not all women will have these specific pelvic floor issues, and not everyone who identifies as a woman may experience these difficulties. And we also understand that pelvic floor problems can affect people who don't identify as women. And so in today's presentation, it's a pre-recorded discussion, and Jody will be online to answer your questions following the presentation.
Hi everyone, welcome this afternoon to our webinar of Managing Your Pelvic Floor. Pelvic floor health is one of those issues that we don't talk about very much, but it has a real impact in women's health, and it can have an impact in people with MS as well. So I'm delighted to be joined by Bec Walhout, a physiotherapist who has an interest in pelvic floor health, and she's going to talk to us about lots of different things about pelvic health. But before I start, we'll do an acknowledgement of country. So in the spirit of reconciliation, MS Plus acknowledges the traditional custodians of the country throughout Australia and their connections to the land, sea and community. We pay our respects to the elders past and present and extends that respect to all Aboriginal and Torres Strait Islanders peoples of today. So just a quick introduction to Bec. I'm sure that doesn't cover it all, but Bec is a physiotherapist who's been in her role for over 20 years. She's worked in a lot of sectors, rural, metropolitan, in public and the private sector. And I know from experience that that gives a great depth of understanding and knowledge about management of about talking to different types of people in different types of settings. Bec completed her postgraduate certificate in pelvic floor physiotherapy in 2015, and since this time she's worked in lots of different continents, clinics, and also within her own private practice. Her caseload involves working with people of all different ages and concerns regarding their bladder, bowel, and pelvic health. She has a functional and holistic approach to treatment and passion about working with people to reach their individual goals. So thank you so much for joining us, Bec, and I am going to leave it with you.
Thank you, Jody, for having me along today. And I think I want to echo your comment about, I think one of the great things about Jean Hale's Health Week is that it promotes conversations. And I hope that at the end of today's presentation, that you might feel a little bit more confident to go, oh, maybe I could talk about my pelvic health, either with my GP or a healthcare provider, or maybe I could talk about it at the gym. Maybe I could talk about it in my mum's group or my book club or my walking group, because it is an area of the body that we all have, and a lot of people experience pelvic health concerns. So the topics that I'm going to cover today, I'm going to start with talking about the where, the what, and the why of the pelvic floor, because it is a little bit of a challenging area of the body to figure out where it is and what's going on. We'll talk a little bit about what's normal in pelvic floor and bladder and bowel and sexual function, and then we'll talk about when things may not be going as they should be and what you might be able to do about that. I'll do a little bit of myth busting, because there's a lot of myths that exist about the pelvic floor. And then we can't have any pelvic floor talk without a few exercises thrown in at the end for good measure. I did just want to say at the start of this conversation, I appreciate that because I'm speaking with MS Plus, that a lot of our listeners today may either themselves have an underlying neurological condition or know someone that does. And we do know that neurological conditions can have an impact on your bladder and bowel function. So if you're starting to notice, or at the end of today's session think, oh, my bladder and bowel are not quite working as they probably should be, it could be the neurological side of things, it could be the pelvic floor side of things. A conversation with your GP is a great way to start, and then or a conversation with a pelvic health physiotherapist, and they will be able to help figure out what might be the underlying cause. All right, so I've got a model of a pelvis here today, and I think this is going to be really helpful to figure out about our what, where, and why. So we can see here, this is a pelvis here, okay? The white bits of this pelvis are the bones. So if we look here at the front, you can see where I'm pointing here, This is a hip socket here. There's another one on the other side. That's where your hips go. If we look up here at the top, these two white bones here where I'm pointing, these are called your ASISs. And if you were to put your hands on your hips, this is where you would pop your hands. If we come to the front of the pelvis, you can see here where I'm pointing, there's a big thick ligament. That's called your pubic symphysis, and you can actually feel that quite nicely on yourself. If you press down low, where you think your bladder will be, you'll feel a really firm bony part. That's the pubic symphysis there. Now, if we turn around and look at the back of the pelvis, just here at the top, this is actually the base of your spine. So your pelvis sits at the base of your spine. You can see here, there's a triangular bone through here. That's called your sacrum. And then right down here at the bottom, that's the coccyx, okay? So hopefully that helps you to figure out where we're talking in our body. The pelvic floor muscles are internal. That makes it really challenging to know if they're working correctly unless somebody is formally assessing them, because you can't see these muscles move, but you can learn to feel them move. So if we look here at the base of the pelvis, this red area is your pelvic floor, okay? There's three openings in the pelvic floor: the urethra, the vagina, and the back passage. And the pelvic floor muscles wrap around all of them. There are two layers of the pelvic floor muscles. There's a more superficial layer and a deeper layer here. So the superficial layer and the deeper layer. So I am still referring to the model. The superficial layer wraps around the urethra, the vagina, and the back passage. You can see there's a lot more bulk at the back passage. Now, often when I'm talking to people in the clinic, they'll think I'm not doing my pelvic floor muscles exercises correctly because primarily what I'm feeling is tightening at the back. That's because there's more muscle there. You will probably feel a little bit more happening at the back passage, but still be doing a correct muscle squeeze. Now I'm going to remove one of these superficial layers here. Okay. And then we can see that there's actually a deeper layer to the pelvic floor as well. And this deeper layer starts right up at the pubic symphysis and wraps all the way around all of the openings. The two layers of the pelvic floor muscles work really nicely together. And when they're doing their job correctly, they're drawing in, so squeezing around the front, the middle, and the back passage, and helping to lift up. If I hold the model back a little bit further, you'll see that there is a sling or a hammock type shape to the pelvic floor muscles. And if you're ever reading anything about the pelvic floor, you'll often see it referred to as a sling or a hammock. Now, if we were to look inside the pelvis, I'm just going to open up here. Going from front to back, we've got the pubic symphysis, then we've got the bladder and the urethra, the uterus and the vagina, and the back passage. And we'll be talking a lot about making sure that you have healthy bowel function today to help you have healthy bladder function. So the three pelvic organs are inside the pelvis, the pelvic floor muscles are underneath, and so provide some lovely support to those pelvic organs. So that's where our muscles are. Their job is to help support the organs, as I've said, help us with bladder function, bowel function, and sexual function. Now, a lot of people wonder, well, what's normal bladder function anyway? Or what's normal bowel function? Or even what's normal sexual function? Because what you experience is your version of normal, but may not be what we actually refer to as normal. So when we're talking about bladder function, we usually say that people should be doing a wee about 4 to 6 times a day, and maybe once or no times overnight. Sometimes as you get a little bit older, to go twice overnight is considered normal. Now, obviously, when we're talking about how often you do a wee, people always say, but doesn't it depend on how much I drink? The answer is absolutely it does. And that figure of 4 to 6 wees a day, 0 to once overnight, is based on a fluid intake of about 1.5 to 2 litres of fluid per day. And of that 1.5 to 2 litres of fluid, we usually say it's okay to have about 2 or 3 bladder irritants. Bladder irritants are drinks like tea, coffee, alcohol, fizzy drink that can make your bladder a little bit more excited. If you have too many of them, you'll find that you probably need to go to the toilet quite often. However, they're usually things that are quite lovely to drink, and so it is okay to have a couple of them, and it shouldn't have an impact on your bladder function. Now, obviously, if you're an individual that does a lot of exercise, or it's very, very hot and it's summer, you're probably going to be drinking significantly more fluid, and that might mean that you're going to the toilet a little more frequently. The other normal thing about bladder function is that we shouldn't be leaking urine. We should be or hopefully we can get an urge that tells us when we need to go to the toilet. We can control that urge, maybe hold off for a little while until we feel that we can't hold on anymore, and then we go to the toilet, sit and empty our bladder well. In regards to bowel function, normal bowel function has a really, really big range. It is normal to empty your bowels anywhere between 3 times a day and 3 times a week. We like people to be able to empty their bowels without too much pushing or straining, and we like people to be able to have good wind control. It's okay to pass wind. It's probably quite normal and really quite healthy, but you want to be able to choose where you do that. Now, a lot of people find the 3 times a day to 3 times a week to be a really, really big range. And that's because there are all kinds of things that impact on our bowel function, including our diet and our activity levels. Now, this next slide we've got here, if you don't like too much information, probably should have warned you to look away. This is called the Bristol stool chart. And it's basically a lot of pictures of different types of bowel motions. Now, again, bowel motion type is impacted and influenced by what we eat, drink, how much we're moving around. But we call normal anywhere between a type 3 stool and a type 5 stool. Ideally, we love a type 4. We want it to be well formed, soft, and easy to pass. It's important to note that if you're on any particular medications, or that you may have some issues with your gut function and motility, a lot of people may require a stool softener or a fibre supplement to help them maintain that or to reach that type 4 stool. Now, there is also an optimal way to sit on the toilet to empty your bowels. And this is in order to prevent putting too much pressure through your pelvic floor muscles that might then contribute to pelvic organ prolapse or bladder leakage. There's a few things I like to point out in this photo. The first one is that you'll see that the person has got their feet on a little footstep. Now, originally when we were probably designed to squat to go to the toilet, because that helps us to have our pelvic floor in a position that's really nice and relaxed and open and makes it much easier to pass a bowel motion. However, we don't squat, we sit on toilets and that makes it quite comfortable, but we can replicate that squat position by getting your knees up above your hips. For most of us, we need to have a little footstep in order to be able to do that. The next thing I like to point out is that you can see the person sitting ever so slightly forward, and that just helps to create that knees above hips position. You can then see that the elbows are resting on their knees, so they're going to be quite relaxed. In order to empty your bowels well, you need to have a relaxed pelvic floor. And if you relax throughout the rest of your body, it is much easier for your pelvic floor to relax. And last of all, you can see that there's a little bit of a bulgy tummy there on the person. A lot of people tell me in the clinic, well, I can sit in this position, but sometimes I just need a little bit of push or a little bit of effort to start to get something moving in my bowels. And I appreciate that. We encourage people to generate that effort through their diaphragm or to use their breath to generate that effort rather than pushing and forcing down with their belly. So often we'll say, lean forward, let your belly relax, and do a long, slow breath out like you're blowing out through a straw. That helps to just generate a little bit of pressure in your abdominal wall, in your abdominal cavity, to help the bowel motion move through. In regards to using the footstep, it's something I really encourage unless you think you might be at risk of tripping over. And if you think you might be at risk of tripping over, I'll often say, well, maybe don't use the footstep, but just lean forward. And this position is really great just for helping you to empty without putting too much pressure through the pelvic floor. Something that I'll talk a little bit further about in the later part of the discussion, but is also normal sexual function. The most important thing to know is it should never be painful. And a lot of people may find that if their pelvic floor muscles are a little bit tight or there's some tissue dryness, that might be causing them some discomfort with sexual function. And they're issues that can be addressed by your pelvic health physician, physiotherapist, or through talking with a GP. Okay, so that's a little bit about where the pelvic floor is, what the pelvic floor does, and what's normal. We've got some numbers on the screen here, and this is to talk a little bit about some of the incidence of things that aren't normal. The first number is 1 in 3, and that's referring to the statistic that 1 in 3 women who have ever had a baby will experience some incontinence of urine. That's a really high number. And I think it's not great that it's a high number, but I think it's important for people to know that if you are experiencing some bladder leakage, you're certainly not alone, and it is okay to start talking about that. The reason why that often occurs so high in women after they've had a baby is because of the pressure that goes through the pelvic floor and the pelvis during both pregnancy and if you have a vaginal delivery during that time as well. We obviously know that when you're pregnant, there's a lot more load being carried through the front of your body. There's a lot more load going through your pelvic floor. There's hormonal changes that occur that can soften the pelvic floor muscles, which means they fatigue a bit more quickly. And then the process of a vaginal delivery can contribute to stretching of the pelvic floor muscles or the fascia, or what we call connective tissue inside the pelvis. There may be some tearing to the pelvic floor as well. And if we're not paying good attention to rehabilitating those tissues and structures after a vaginal delivery, then that can contribute to some urinary incontinence. The next number I've got there is 1 in 20. Now that's the number of people that experience fecal incontinence. And it's possible that that number is actually more like 1 in 10. Now, we're not very good at talking about urinary incontinence in the general population. We're even worse at talking about fecal incontinence. And obviously, it's an issue that can cause a lot of embarrassment to people. You can see there's a 50% written there as well. 50% of women will experience pelvic organ prolapse symptoms at some stage in their life. Now, a pelvic organ prolapse is where the organs inside the pelvis, so the bladder, the uterus, or the bowel, descend down into the pelvis. And often people will become aware of this when they feel a sensation of a heaviness or a dragging or a bulging. Often they'll say, I feel like I've got a tampon in and it's falling out. And that can be a very uncomfortable and quite distressing symptom for a lot of people. The risk factors for a pelvic organ prolapse: pregnancy, vaginal delivery, a history of chronic constipation, a history of repetitive coughing, or heavy lifting, or participating in maybe some heavy weight training with poor technique and breath holding. The final number I've got on the screen is 70%. And I think this is the one that actually concerns me the most as a pelvic health condition. 70% of people who experience a pelvic health concern will not do anything about it. And I'm not exactly sure why they don't. Maybe they think it's in the too hard basket. Maybe they're too embarrassed to talk about it. Maybe they think, oh, isn't it just normal to have a bit of leakage after I've had a baby? I just need to put up with that. But it's a really high number. And the other number I should have on there, which is the encouraging number, is that 70% of people who have urinary incontinence, if they participate in a pelvic floor muscle training program, they'll either be cured or improved. Now that's really quite a high success rate just by working on your pelvic floor muscles. So I hope these numbers help you to think, I'm not alone in my pelvic health concern, but it's okay to seek help and that there's a lot that can be done to improve my symptoms. All right. Now, I'm going to talk a little bit about some myth busting, and it probably leads on quite nicely after that slide we've just talked about. So a large percentage of the people that I work with in clinical practice are in their perinatal period. So they're either early in their pregnancy, they're about to have their baby, or they have their baby. And a really common thing that we hear is, well, isn't it normal to leak after I've had a baby? Now, after looking at those previous numbers, we'd say it's very, very common, 1 in 3, but it is not normal. We were not designed to leak urine. And a lot can be done about it. We know that there are a lot of changes going on in a woman's body at the time of pregnancy and postpartum. Some of those changes make it harder to maintain bladder control, but after you've had your baby, we also know that there's a lot of really positive healing that can happen to help you improve your pelvic health and your pelvic floor muscle strength. So it is the most important thing to know. It is common to have leakage after you've had a baby, but it is not normal, and a lot can be done to improve that. The second myth, and we hear this one a lot, particularly in gyms, I think. And that myth is, if I go and see the pelvic health physio and tell them that I leak when I run, they're going to tell me that I have to stop running and I have to stop doing the exercise that I love, and I'm just not going to do that. Now, the first part about this myth that I would like to bust is that your physio is not going to tell you that you can't exercise. Nobody loves exercise more than your physio. We know that exercise is so important for so many aspects of our health. It's important for our physical health, it's important for our mental health, it's important for our bone health, it's important for our gut health, and I could go on and on and on. However, we don't want you to be leaking when you exercise, and that's usually a sign that your pelvic floor is not able to keep up with the level of load that you're putting in your body. So certainly your pelvic health physiotherapist will talk to you about your goals and about your exercise and about how much exercise you're doing. And then we'll usually work with you to develop a plan so that your pelvic floor strength is strong enough to keep up with the load that you're putting in your body. Now, for a while, that plan might involve reducing the amount of, let's use running as an example, that you're doing, or even taking a break from running, but substituting it with an alternative exercise in the short term, while you improve your pelvic floor strength and speed and endurance to match the demands of your running. But there should always be a goal to get you back to doing what you love. And if after a period of rehabilitation, they've figured out, okay, you've strengthened your pelvic floor, but there's still some issues with leakage, there are always extra supports that you can use to help support your bladder and your pelvic floor while you're doing that exercise. But please do not put off going to see the pelvic floor physio because you think they're going to tell you that you can't do what you love. The next myth, and this is a really common one. I work with people of all ages, and often I'll be working with someone who's maybe postmenopausal in their 60s or 70s, and they'll say, look, I've had this problem for 20 years. I've learned to live with it. It's too late to do something about it now, isn't it? The answer is it is never too late. We can strengthen muscles at any age in our life. It may take a little longer to get them strong, but they can still be improved. The other thing is that often bladder or bowel issues are not just about the pelvic floor. Pelvic floor is a really important part of your bladder and bowel health and your sexual health, but it's not the only part. For some people, they may be experiencing bladder urgency, and leakage associated that, where they feel like they need to go to the toilet really frequently throughout the day and without much warning. And sometimes we might realize that actually that's because this person has developed a habit of drinking 6 or 7 cups of tea every day, and they're a little bit constipated as well. And with a few changes in their fluid intake, some improvements in their bowel health, and some pelvic floor training, they get a really fantastic outcome. So it's really important to know that it is never, ever too late to start working on your pelvic floor health or your pelvic health. The next myth. And this is a really interesting one, and one that we hear a lot, probably particularly in the younger population. And by that, I mean even people from their late teens who may be experiencing some bladder leakage through to a postmenopausal population. And a lot of people come in and they say, well, I'm leaking when I play netball, or I'm leaking when I bend over and pick up my grandkids. So I'm assuming my pelvic floor is really, really weak. And I've tried to do my exercises and I can't feel anything happening. So I must be really, really weak. And in the process of doing our assessment, we find out that actually the pelvic floor is not really weak, but actually it's holding on too much. And that's what we refer to as a pelvic floor with a high resting tone or an overactive pelvic floor. A nice way to help people understand this idea is the phrase that we use that says a healthy muscle needs to know how to contract, but it also needs to know how to relax. And if that muscle doesn't know how to relax, and it's actually holding really tightly all the time, you can end up with a whole lot of pelvic health concerns. Now, those pelvic health concerns can range from anything from, I have a lot of difficulty putting a tampon in. When I try to put it in, it just won't go in, no matter how many different types of tampons I try, or how often I try, or how many different positions I try. An overactive pelvic floor or muscles that doesn't like to relax can also present as a condition that we call vaginismus, which can be related to difficulty putting tampons in, but also difficulty having penetrative intercourse, where the muscles are just really, really tight. And people will often say it feels like there's a brick wall there and nothing can go in, and it becomes very painful and I can't get it to relax. And then sometimes people will also have associated bladder weakness because this muscle is holding on all the time. So much so that when you cough or sneeze, you can't quickly activate that muscle because it's so fatigued from holding on all the time. Now, this is a condition where it's really important to seek help, and individual help from a pelvic floor physiotherapist, because if you do Googling or read online or brochures, often when they talk about a pelvic floor issue, most people assume they're weak. And they'll read that, oh, I need to do more squeezes and I need to do more squeezes. Now, if your pelvic floor is already holding on really tightly, and then you're trying to do more and more pelvic floor squeezes, you're not going to progress. You're actually probably going to feel like you're making your condition worse. And that's really disheartening, and you might give up altogether. So this is one of the other reasons why an individual assessment is always really important, because everybody's symptoms and presentation can be really differently. I guess to answer the question, we'll go back just once more to the tight pelvic floor. People often say, well, then what do I do if it's too tight? And what we do in that situation is we do a lot of education so that people know where their pelvic floor muscles are. We teach them how to let their pelvic floor muscles go. And there's lots of different ways that we can do that. It might be by using an ultrasound machine where we can gain picture of what the pelvic floor muscles are doing by doing an abdominal ultrasound, and teach people how to let their muscles relax, and they can see that happening on the screen. Then they can learn to feel that in their body. We often work a lot with breath work and diaphragmatic breathing. because the diaphragm and the pelvic floor are really closely related. And so if we can get your diaphragm moving well, we can help you to get your pelvic floor relaxing well. And sometimes it involves on working on overall body relaxation or particular stretches as well. Another common myth I hear, and possibly a fear as well as a myth, if I go to see the pelvic floor physio, I'm going to have an internal examination. And I really don't want to have that, so I'm not going to see the physio. It's true, pelvic floor physiotherapists have done extra training and have learned how to do an internal examination, and that is classified as the gold standard for assessing the pelvic floor. However, it's not the only thing we do. And I think this myth leads really nicely into the question of, well, what should I expect to happen when I see a pelvic floor physio? The first thing that you should expect to happen is you're going to have to answer a lot of questions, because we ask a lot of questions. Usually an initial appointment will go for about an hour, and we want to know about your fluid intake. We want to know about your exercise. We want to know about your bowel function. We want to know about how many times a day you go to the toilet, how often you do a bowel motion, what you like to do for exercise. Are you in a stage of life where you're busy looking after small children all day? Are you looking after grandchildren all day? We want to know about what your goals are, whether they're to run a park run or run an ultra marathon or lug a suitcase or a backpack around the world, because we want to make your treatment really individualized. We will often get you to do a lot of charting, which basically is like your homework. We'll send you home, we'll ask you to measure what you drink and measure how much wee you do. We want to find about what kind of fluid you're drinking as well. Now, if we get to the part of the assessment where we think, okay, we need to know what's going on with your pelvic floor, there are lots of different ways that we can do that. I've already mentioned transabdominal ultrasound, which is used really commonly by pelvic health physiotherapists. And that's a way where we can get a really nice idea about what's happening with your pelvic floor without doing an internal assessment. Sometimes we'll work a lot on yourself just sitting and doing some exercises and making sure that you can feel the pelvic floor muscles working. We may get to a point in your treatment where we think to move forward, we really do need to have a better understanding of what's happening with the pelvic floor. But by that stage, you might be really comfortable with your pelvic health physio and you've met them several times and you might be feeling quite comfortable to have an internal vaginal examination, or you may still choose not to. And I've worked with many people where I've never done an examination on them and we've been able to get excellent outcomes and help them achieve their goals. Alternatively, some people turn up to the appointment and they say, before we even ask any questions, I really want you to check my pelvic floor because I really want to know what's going on down there because I think things are a bit different, but I can't see or check myself. So it is certainly also completely fine that your pelvic floor physio might do an internal examination on the first assessment. But I guess please do not let fear of an examination stop you from going to the pelvic floor physio and having your pelvic health issues treated. All right. The last part about what I was planning on talking about today was actually doing some pelvic floor exercises, because we've talked a lot about where these muscles are and what they do, but I think it's helpful that people know how to exercise them as well. So what I would like you to do is sit back in your chair if you're sitting down, make sure your feet are flat on the floor, and that you're nice and relaxed through your shoulders and your belly. I often ask people to put their hands on their hips, and then I'll say, I want you to do a little tilt forwards and backwards, and then tilt forwards again. So you feel like you're sitting over your vagina. Now, in this position, I'd like you to breathe in and breathe out, and then squeeze in around your anus and vagina. And then let those muscles relax. Let's do that again. Breathe in, breathe out, squeeze in around your anus and vagina. Hopefully you're feeling that area of your body, which is called your perineum, lifting up and away from the chair. Then let everything relax back down. Let's try one more time. We'll see if you can hold for 5 seconds. Breathe in, breathe out, squeeze around your anus and vagina, hold, 2, 3, 4, 5, and relax. Now, just as you give your pelvic floor a little break there, there's probably a couple of things that I like people to be aware of when they're doing their pelvic floor exercises. We're exercising the pelvic floor muscles. They are inside the body. What they're not your glutes, they're not your thighs, and they're not your stomach muscles. You may feel a little bit of drawing in through the belly, but the other muscles should be relaxed. And a nice way to think about this is that no one should know you're doing your pelvic floor exercises when you're doing them, because the muscles that are working are on the inside. You should also be able to maintain a normal breath whilst you're doing that. And sometimes it's helpful to count out loud in order for that to happen. That would be, the squeezes that we did there for 5 seconds would be classified as some strength squeezes. And sometimes I get people to work them up to 10 seconds in a row and maybe do anywhere between 6 to 10 repetitions, depending on what they can do. I also like people to do some fast squeezes of the pelvic floor. It's the same movement, but then tightening and letting go. So let's have a quick go at 10 of those. So sitting in that same position, breathe in, breathe out, squeeze around the anus and the vagina and relax. Squeeze, relax. Squeeze, relax. Squeeze, relax. Squeeze, relax. Squeeze, relax. Squeeze, relax. One more, squeeze and relax. They would be some quick coordinated squeezes that you could practice on a daily basis. The other part of the other exercise that we often include is an endurance hold. And that's where we get people to work on holding their pelvic floor muscles for anywhere between, say, 20 to 60 seconds to help them build up the capacity of that muscle to hold over a long time. People often ask how often they should be doing their pelvic floor training. It really depends on what your goal is and what your starting point is. If somebody is quite weak in their muscles and can't do many squeezes in a row, I'll ask them to do them quite a few times a day. If someone is really quite strong, they may only be exercising their pelvic floor once a day or 3 times a week as part of an additional strengthening program. It really depends on what your individual goal is. So I have got a couple of websites here for anyone who may want to know more. The Continence Foundation of Australia is an excellent resource for all things continence for people of all genders and all ages. Particularly, they have an excellent tab on their website, which is the CFA Find a Physio tab. Because you might be thinking now, after you've listened to this talk, well, maybe I would go and see a pelvic floor physio. I think the important thing to know is you really do need to see someone who has had additional training in pelvic health, not just your regular physio that you might see for your back or your neck. You could ask your regular physio if they know somebody in the area. You could ask your GP, or you could go to this website where you can put in your postcode and it will bring up a list of the pelvic health physiotherapists in your region, and that is nationwide. The other website there is the Pelvic Floor First website, which has got some excellent tips on activating your pelvic floor and fitting that into regular exercise as well. Now, Jodie, I think there were a few questions that had come in prior to today's discussion. Do you want to hit me up with
Thanks, Bec. I feel so pure now that I've done my pelvic floor exercises. I feel very good on me.
You can cross them off your to-do list for today.
Yeah, that's right. That's right. One of my questions was, what else? We have had a couple of questions, but one of them was what else can you do for your pelvic floor in terms of other exercises, is there any equipment or anything like that that can be of use as well?
Mm-hmm. That's a really good question. So individually for your pelvic floor, I guess I'll use the example. If I'm working with someone who is a CrossFitter, so they lift, or an Olympic lifter, and they're lifting really, really heavy loads in the gym, we need their pelvic floor to be really, really strong. And so there are products, vaginal weights. There's lots of different brands, and sometimes we will actually, to get somebody to a really, really strong pelvic floor, we'll add vaginal weights to their programs. And vaginal weights are exactly what they sound like. They're weights that you put inside your vagina and you exercise your pelvic floor with the vaginal weight in place. So those muscles are getting a really hard workout. It's not something I recommend for everyone straight away, because there's a few fundamentals that we usually need to make sure are happening first, like correct technique and working to your limits on a regular program. But vaginal weights can be a great extra. Some people may have also heard of, there's a probe you can purchase that links via Bluetooth to your mobile phone, and you can actually do a pelvic floor workout like you're playing a game on your phone, and it will give you feedback on how well you are working your pelvic floor. Some people find that really motivating and a really helpful way to keep them doing their pelvic floor exercises on a longer basis. Some people will use an app to remind them to do their pelvic floor exercises, because remembering to do your pelvic floor exercises is a huge part of the challenge. And if you don't do the exercises, they don't work. So apps can be really helpful. If someone has quite a weak pelvic floor, sometimes we will use an electrical stimulation machine to help them get their pelvic floor working in the early days. That is something that usually would need to be prescribed by your pelvic health physio, but it can be really helpful. So there's lots of extra bits you can help there. In terms of general exercise, you can work your pelvic floor when you're doing your regular workout, if you know how to work those muscles correctly. And there is some evidence to show that working your pelvic floor in certain positions, like a bridge position or clam, which is an exercise some people might be familiar with, can actually help to strengthen that pelvic floor even more as well. However, you do need to have the basics right first.
Thank you. Great. The other question that that we did have come in before the webinar, but also one that I had very commonly in clinic, was what was around pelvic pain. Like, what is pelvic pain? How do you know that you've got pelvic pain as opposed to another kind of pain? And then what do you do about it?
Great question. We could talk for another hour on that. But basically, yeah, probably I won't though. Pelvic pain, it's pain between the belly button and the hips. It's pain that's, we're talking about persistent pelvic pain, it's pain that's been there for kind of 3 to 6 months. We do rule out other things first. So some people may, if they've initially got pain, they'll go and see their GP first. They might have to rule out a few other conditions. But persistent pelvic pain often comes along with some other health conditions as well. So it may be related to something like endometriosis. It may be related to polycystic ovarian syndrome. It may be related, there's a condition called interstitial cystitis or bladder pain syndrome. That may also be related to pelvic pain. Like all pain that's been present for, well, I guess there's acute pelvic pain and there's persistent pelvic pain. Sometimes the more acute pains can come about due to some maybe having a urinary tract infection or recurrent infections that haven't gone away and will give you some symptoms of pain, maybe recurrent thrush. So we need to be considering what's going on with the tissues in that area, and are they a source of the pain? Or if the pain's been there for a really long time, have the muscles then become in the pelvic floor become very tight? and forgotten how to relax, and then they may be a contributing factor to that pain. And like all pain, it's often not just one thing. We're often looking at lots of different aspects of your health when we are treating pain, but increasingly pelvic floor physiotherapy is becoming recognised as a really important component of treating pelvic pain in a holistic way, and a lot can be done in that area. I guess if you've got questions about it, I would say talk to your GP. They may want to rule out a few other things first, but it's something you could certainly bring up with a pelvic health physio as well, and they will be a big part of your journey if you are experiencing pelvic pain.
Thanks. I guess, like we said at the start, you know, it's often things that we don't talk about, pain down there, and it's and there is so much that you can do about it. And I really liked the way that you focused on it's never too late to start working on your pelvic floor. And in my experience, it can also really assist in the management of MS. It's not the cause of bladder dysfunction in women with MS, but it really contributes to the problem, and it's also something that you can do to actually promote better function as well too. So I have found that it's been very beneficial for women to go and see a pelvic floor physiotherapist as well too, and open up that conversation. Now, when you're going to see a pelvic floor physiotherapist, do you need a referral for that, or can you self-refer?
You can certainly self-refer, so you do not need a referral at all. Some people can access pelvic health physio under a care plan. So if that's which assists with the cost, if that's the case, you do need to see your GP first. If you were going to see someone in the public health system, so one of the larger continence clinics, you would need to be referred in that case, usually either by your GP or from within the hospital system. But to just go and see a pelvic health physio at a local clinic privately, no referral is needed. So there's not too many barriers there.
Great, that's fantastic. And you talked about some of the other barriers, which was in the myth busting, so that was fantastic. But otherwise, thank you again. That was fantastic. Such a great overview, and we really appreciated it.
Hi everyone. Welcome to the end of the session. I hope everyone did their pelvic floor exercises. That meant I got to do them twice, so that's good. So we've had a couple of questions come in. One of them was about flatus incontinence, which is inability to hold passing wind, and it can be a problem that can occur in MS because the innervation to the anus has got 3 muscles surrounding it, and those muscles can be impacted by multiple sclerosis, which can include flatus incontinence, or it can also worsen bowel incontinence in MS. There's a test called anal manometry that can be done to test your ability of your anal muscles to be able to do that. And so it is something that we saw in people with MS, and so if you suffer with that problem, it may not be MS, but the anal manometry can certainly help guide you to what's causing the problem and what you can do about it. As women age and the hormones, the loss of estrogen also means that the pelvic floor muscles will weaken, and that can also contribute to difficulties with holding passing wind as well. But as I said, it definitely can be a problem with MS, and there is something that you can do to get it tested. The other question that we had come in was also about, can exercises help with urinary hesitancy? It's probably worth, in terms of my experience with MS, having the pelvic floor open can, having the positioning right that Bec talked about was something that can really improve it a little bit. But I don't know about specific hesitancy exercises, so we'll forward that question to Bec and ask her. Another question that came through was how does MS impact bladder control and urgency? And also that the question was my neurologist says my bladder urgency is the result of MS and not poor pelvic floor. muscles. So MS can definitely and very commonly, in 85% of people, it does impact bladder function. And so it's certainly something that we know well. It impacts bladder function by causing hesitancy, urgency, and also incomplete bladder emptying. And sometimes you get all three of them: hesitancy and urgency and incomplete bladder emptying. And that's because that is a nerve problem. It's a nerve problem that around the bladder the bladder is like a balloon, but around it is a muscle, and the innervation of that muscle is from nerves exiting the spinal cord. And so generally, like 99.9% of the time, unless you have a lesion in your spinal cord, your bladder function might be caused by another problem. But when you do have a lesion in your spinal cord, you can, anywhere along the spinal cord, can innervation of the muscle supply, and some lesions in the brain do as well too, but they're much less common. And so this is talking about that the pelvic floor is a different set of muscles than the muscles around the bladder, and so many women have impacted pelvic floor, and many women have poor pelvic floor muscles. So I always felt that when you were looking at the whole picture of how you manage bladder urgency, it's a what comes first, the chicken or the egg sort of scenario, where which has got more impact, the MS or the pelvic floor function. Probably the MS has more impact on bladder function in terms of severity, but it certainly, there is strengthening your pelvic floor certainly does help. And so it's also particularly where she talked about the pelvic floor not necessarily being weak, but I always just think of it as an uptight pelvic floor. That can also really contribute to that too. So if you're really struggling and with bladder management, it's another having pelvic floor exercises and doing pelvic floor exercises are another opportunity, and to be able to sort of improve your quality of life by doing that. And certainly one visit with a pelvic floor physio specialist can certainly tell you a whole lot about your pelvic floor and whether you do or don't need to do exercises, what exercises you need to do. For instance, if your pelvic floor isn't weak but agitated, then, or uptight, like I called it, then you can actually, it's actually a different set of exercises that you can do to help with the pelvic floor. So your neurologist is technically right. It may not be because only it may be because of the result of the MS, but it doesn't necessarily mean that there's nothing that you can do about your pelvic floor as well too.
Great, and those were most of the questions.
Okay, well, thank you, Jess. In terms of it's Women's Health Week this week, something that we're very passionate about at MS Plus. The majority of people diagnosed with MS are women, and so it's also really important to keep on top of women's health checks. One, while you're on MS medications, but two, also because in my experience, women really tend to MS seems to take over a lot of health issues, and women's health issues seem to get missed in the general population and just as much in people with MS. So, and sometimes that's just because it's hard to start the conversation. Sometimes it's because of a lack of knowledge, and other times it's just because it's really hard to have the conversation with the GP. So what we've done is made a preventative health tests checklist for that's on our website. You can just we've made it so that you can take a photo of it on your phone, so you don't have to print it out. But you can also print it out and bring it to your GP and say, and your neurologist, and say, do I need to have these health checks, or this is what's recommended, what do I need to do that's specific to me, is there anything else I should have, and how can I and then that you can also use that to take to your GP and organise your visit so that you can maximise that one visit you have with the GP, or you can, some people can access their GP more than once, but they're very commonly access to GPs can be difficult, or a bit of a barrier to having some of these tests done. So we've given you some information about those tests, and even for instance with the bowel health, having a bowel test, you can actually get the kits if you ring the National Bowel Cancer Screening Program, which not many people know that you can get them like that too. So That's available for you as part of what we're doing for Women's Health Week this week. And don't forget to look after your women's health. If you need other support services, this is some of the stuff that MS Plus does. We have support coordination for NDIS, allied health, physio, OT, continence management for continence nurses. We have our specialist MS nurses who are available and have talked and have extensive experience in people with MS. And then we have financial assistance and peer support programs as well too. So all this information will be available. This webinar and further information are available on our resource hub. And that's it from me, Jess.
Thank you.